Good morning, GPs down under. And after the success of yesterday's video, I thought I'd better continue with this. As promised, today is Swabbing 101, in particular the chlamydia and gonorrhea edition. Yay! So for all of the people who are watching this video with kids in the room, there could be explicit language. So just be prepared to explain what the hell that Dr. George is going on about when the kids come asking. Looking at you, I know you. So anyway, as I said yesterday, we do need to actually swab throats and bums, and we're checking for chlamydia and gonorrhea. Sometimes we also need to swab urethras, and I'll talk about that as well. So with the first swab I do is the throat swab. It's the easiest, but also the yuckiest. Patients hate having their throat swabbed. So what I end up doing is I say to the patients, I'll just get you to come and grab a seat with your legs hanging over the side of the bed. So they're sitting on the edge of the bed. I find that most of the guys that I see are bigger guys. So you do have to use a tongue depressor to get the tongue out of the way, because you need to see a good view of the pharynx. And you want that because you are actually going to look for pus, but you're also going to look for syphilitic cankers or blisters or anything like that in the back of the throat. So if you see any of those, direct your swabbing towards those. Most of the time the throat looks, normalish, pinky, ready, whatever. So with a throat swab, it's important that you need to be targeting three main areas, both of the tonsillar columns and the back of the pharynx. You want to hit all three areas. I go 1, 2, and then a bit of a swab down the back there. If the person gags, it means you've actually done it correctly. So that kind of reaction is what you're aiming for. I find that if people aren't, if you can't get a good view of that, if they've got, what is it Zampati? Anyway, one of those things, whatever that an anesthetic term is for short fat neck, if you can't see the back of the throat, it's best not to do it blind, because patients really hate that. But also just get them to go, and that tends to bring the pharynx up and makes it much, much easier to see. And it also depresses the tongue down. That sound is, to articulate it, you need to push the tongue down. So side, side, back, and swab. And for this particular swab, you're using a dry swab. I don't actually have a dry swab here just at this exact point. This is a flocked swab, but I just use the dry cotton swab, and it's the one that has no culture medium in the bottom. It's a dry swab. It's just going for a PCR. That's chlamydia, gonorrhea, PCR, mark it as throat. For bum swab, you do the exact same swab. So I use the dry cotton swab. Now, I wet the swab with water because it makes it go in a heck of a lot easier, and your patients don't scoot up the side of the bed. Positioning wise, I put them on their side with their knees bent, facing in towards the wall. And the way I say that is, I do the throat swab and say, okay, we just need to do the bum swab now. I'll just get you to lay on your side facing in towards the wall. A lot of people think they're being really, really helpful when they're grabbing their arse cheek and pulling it up to give you a better view. I actually find that it's just easier, glove up, part the cheeks, and have a good look. Before you do the swab, you're having a look for warts, and I have seen plenty of syphilitic cankers at the anal verge as well, so it's worthwhile having a look. Now, let's talk gonorrhea and chlamydia. Gonorrhea and chlamydia cannot grow on the squamous epithelium, so for that reason, you need to get past the dentate line. That's where it goes from a squamous epithelium to a columnar epithelium. So you need to be going into the bum at a minimum of, say, 2 inches there. So you wet the swab, and here's a simulated bum that I created earlier. And I like to gently twist it in. Twist, 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 twist. If you're feeling any resistance, pull back a little bit and then just try from a slightly different angle, and then twist on the way out, and bada boom, bada bing, into the tube. Again, no culture medium. It's a PCR, so it doesn't particularly matter if you wet the cotton tip with tap water, because they're not actually doing a culture on it. If it does come back positive for chlamydia or gonorrhea, that's when I do a blue top with culture medium, because we want to actually see what the heck we're growing. That's pretty much it. That's a bit. Oh, the other thing is that if somebody has a penile discharge, generally as a rule, if somebody is asymptomatic, for chlamydia or gonorrhea in the penis, I just do a urine sample. However, if somebody has pus coming out of the tip of the penis, it's best to get a swab. And the way that I do that is with these little fellas. And nobody says thank you for this one, by the way. These little wire tips. And so basically you need to hold the head of the penis, separate it so you can see the eye of the penis, and you just need to go into the eye of the penis and back. The rules say you're supposed to go in 2 inches, swirl it around, and then pull it out. Good freaking luck. If you can get somebody to sit still for that long, good luck. But I actually have to tell my patients, it's uncomfortable, it's going to be sore, I need you to stay as still as possible. I use those words because it doesn't freaking tickle, and the more that they move, the more that they kick, the more that you have to go back and do it again. And this is where paternalistic medicine comes out, where you actually have to be the parent and you say, I'm sorry, you're just going to have to sit still. It's like giving a baby a vaccination or a toddler a vaccination, where you just have to say, you just have to sit still and just get it done. And that way you can do a culture on whatever that pus is and work out what it is. And if you can get a PCR at the same time, that's great. If they've got pus coming out of the eye of the penis, just swab that. It's much, much easier. But anyway, I hope that's kind of helpful. But this is how I do my swabs. If you have any questions, I'm happy to answer. And thank you so much for the participation in the previous thread. I really, really appreciate it. And it's so good to see that we have a live, vibrant group of people here. So hope that was helpful. And if I've left anything out, send me a note and I'll do another video. Have a great day, guys. See ya. Happy swabbing.